Child. Okay, yeah, I think child, someone did have child AED?
Yeah, I did.
Okay. All right, so it's child, adult, same thing, right? Unless we, what's the one modifier with a child with an AED?
Different pads.
If, yeah, and right, so our description, which we'll just show right now, okay? So here's your little kindergarten age, let's say 5-year-old, okay? So it's significantly lower than 8, right? So here's your 5-year-old child playing soccer, passes out on the field. Go from there.
All right. PPEs, assessing the scene. Is the scene safe?
Scene is safe.
All right, now I'm going to approach. Hey, are you okay?
A is not responding.
Is there anyone around here with me? I'm at a soccer field?
Yep.
All right, I point to someone, you, call 911, get an AED. Then going to check the pulse, put my hand on the stomach, listen for 5 to 10 seconds, look, listen, feel type thing.
Okay. No pulse.
No pulse, no breathing. I'm going to go to my compressions. This will be 30 and 2, it's 2 inches.
Should be one hand for kid?
You can. If, yeah, you can use one hand. So the reason why they show it that way, because in a real life setting, if this is a 5-year-old, 2 hands might be too much force for most of us. So definitely use one hand. But again, to make it easier for you guys, just always use 2 hands, whether it's adult, child. If you use one hand on an adult, you're going to miss points.
And with myself, I always use 2 hands because it's more comfortable for me. If I'm just doing one hand, I'm not going to be as consistent with the depths that I'm doing. I'm not going to be as controlled, and then you're going to get more tired. So personal preference for me.
Okay, so 28,
28, 29,
30.
Got my mask. I'm going to deliver 2 breaths. These breaths are over 1 second.
Okay, that AED you asked for has arrived. Okay.
All right, going to come over here. Going to turn it on first.
This is a training device only. No shock will be delivered.
So turn it on. First thing, remember, just turn it on. For those of you that missed the AED portion, just this is where you can shut your brain off. If you have all this anxiety about testing, this is where you can just sit back and just listen to the AED. Okay.
So what I've done is I expose the chest. I am looking to see if there's sweat, there's hair, there's any metal implants, anything that would not let you do this. It's clear. I'm going to look at the pads. I'm going to attach the pads right where they want. One on the front and one on the side.
Connector and pads.
So for the test, if you have this mannequin, just put it on the front of the chest, right? So his thinking right there is, okay, it's a 5-year-old, maybe a little smaller, you could go front back. But that's only if we lay the infant mannequin in front of you.
Connector and pads.
At which point I will check the connector and pads. They're secure. Now I will plug
Analyzing
it in.
rhythm. Everyone stand clear.
Everyone stand clear.
Shock advised. Charging.
Now that does not mean start pressing shock right now. I had a lot of people doing that. Everyone's clear.
Everyone stand clear. Push the shock button.
Everyone clear.
Shock delivered. Begin 5 cycles of CPR.
Now we'll go into 30 compressions.
Okay, so that's AED. So now another portion of this was, okay, that other rescuer that brought the AED is assisting you. Okay, so please demonstrate for me 2 rescuer CPR compressions.
All right, so
for this victim.
Since this is a child, it's going to go to 15 and 2, so I will give 15 compressions.
All right, and it's as simple as that. Okay, so it's 2 rescuer. We'll verbalize, demonstrate compressions. Just say 15 and 2. 4 and 15 and 2. You can turn that off. Okay, now please demonstrate for me 2 rescuer CPR breathing.
Going to be at the head. I'm going to use my same EC clamp here.
Make sure on the test you move, don't move the mannequin. I'm
Yeah.
just trying to make it visible for you guys.
Here, 1 breath over 2 seconds, or 1 breath over 1 second.
Okay, again, we're still in CPR, not rescue breathing. Okay, so I don't remember what prompt it was for. I think either child, infant, or adult. If we ask you to demonstrate rescue breathing, we'll actually say rescue breathing, or we'll say, what do you do? They have a pulse but no breathing.
I know that's how I prompted it, and it was with choking victims. It was after the object was released. You look, listen. So the object's released. You give your 2 breaths. Then you want to check the pulse and you want to check the breathing. That's when we said there is a pulse, but the patient is not breathing. that is an indication you need to do rescue breathing. Your job is to do whatever the patient is not able to do. If the patient has a pulse, you do not need to compress for them. If the patient is not breathing, you need to breathe for them. At the very beginning of CPR, we check the pulse and we check the breathing. When they do not have a pulse, that tells us we need to be their pulse. That means we do compressions. Does that make sense?
Yep.
You do what the patient is not able to do. That is why we are here, to help them.
And it's real simple to just memorize no pulse, no breathing, CPR. Pulse, no breathing, rescue breathing. Pulse and breathing, recovery position. Just those three things as far as the end result. At the end when we say, okay, this person has a pulse, but they're not breathing. Demonstrate what you would like to do.
All right. I would move myself, mannequin. I would do rescue breathing. Rescue breathing is going to be 1 breath every 5 seconds. The breath will be given over a second. So I will sit here, I will give the first breath.
Remember, that's your safe number. A lot of you were impressive and you knew if it was a child, 3 to 5, child and infant, 3 to 5, and adults, 5 to 6. Okay? But again, your magic number, for sake of remembering a lot of things, is just 5 seconds for rescue breathing. Okay?
And the breath goes in over 1 second. It is not.
Yeah. So steady. So just mimic what a normal breath would be for an individual. Okay? Make sure, so, and obviously most of you verbalize correctly, okay, rescue breathing 5 seconds, but you're sitting there just squeezing the bag every second. Okay, so make sure, just, yeah, and we'll prompt you too, okay, please demonstrate. Right? So you gotta demonstrate as well as verbalize. Good? Any questions there? Okay, so that's child. So AED, obviously BPM for 2 rescue.